Have you ever felt a painful lump in your breast while breastfeeding and wondered what was going on? If so, you are not alone. I'm Dr. Mona Amin, a board-certified pediatrician, IBCLC, and mom, and today we're discussing clogged ducts and mastitis, what they are and what you can do about them. Stay tuned to learn when you should seek help from your medical provider and common mistakes people make when they approach clogged ducts. Let's get to it. I want to start this video by sympathizing with how painful clogged ducts and mastitis can be. I was an exclusive pumper for my daughter and I got clogged ducts twice and they were painful. Both of mine happened while traveling and this was likely due to not being able to stay on my schedule, stress, dehydration, and more. We'll get into prevention and management of clogged ducts and why it's important so you don't get mastitis. A clogged duct is when milk gets backed up in one of the milk ducts, creating a blockage. You'll usually feel a tender, firm spot in your breast, and it might be a bit sore to the touch. Imagine you're watering your garden with a hose and suddenly there's a kink in the line. The water can't flow through smoothly, so pressure starts to build up behind the kink. In the same way, when a duct in your breast gets clogged, milk flow is blocked, causing discomfort and sometimes swelling as the milk builds up behind the clog. Just like working out the kink in the hose lets the water flow again, massaging and clearing the duct helps the milk move through smoothly. The key thing about a clogged duct is that there's no infection, just milk that needs a little help to get moving again. Mastitis, however, is when a clogged duct becomes inflamed and sometimes even infected. It often starts when milk builds up in a duct that hasn't been cleared, which can irritate the tissue around it. With mastitis, you'll usually notice redness and warmth in that area, and you might feel like you're coming down with the flu. This inflammation can make the breast very painful and tender. Engorgement, clogged ducts, and mastitis are related but distinct issues that can arise during breastfeeding. Engorgement happens when breasts become overly full, making them feel hard, tight, and sore across the entire breast, which can affect latching. The breast as a whole feels heavy or like a rock, so relieving pressure by feeding, pumping, or hand expression can help. If milk isn't emptied, clogged ducts can develop, creating a painful lump or knot in a part of the breast. Left untreated, this potentially can lead to mastitis, an inflammation or infection with symptoms like redness, swelling, and fever. Understanding these issues and intervening early can improve milk flow, reduce infection risk, and keep breastfeeding smoother for both you and your baby. Like I mentioned from personal experience, having a clogged duct is very painful, and frequent mastitis can feel even worse. So knowing the signs and prevention can help extend your breastfeeding journey. If you have a clogged duct, you'll usually notice some specific signs. Localized pain in one part of your breast, a small lump that feels tender or firm, and sometimes a bit of redness in that area. The pain is typically limited to one spot, and it's often sore to the touch. Clogs can happen for several reasons. Infrequent breastfeeding is a common cause, like if you skip a feeding or go longer stretches between feeds. Wearing tight clothes or a bra that puts pressure on the breast can also lead to a clog by restricting milk flow. Sometimes if you're starting to wean or reducing breastfeeding sessions, milk can back up in the ducts, causing a blockage. To help prevent clogged ducts, try to feed or pump regularly to keep milk flowing and increase spacing between sessions gradually if needed. If you're engorged, pump for comfort, adjusting based on your supply. A good latch and correct flange size, if pumping, are essential for efficient milk flow. Check out my video on common pumping mistakes for more tips. Wearing loose-fitting clothing and weaning gradually can also help reduce pressure and prevent clogs. So how do you manage a clogged duct if you're already experiencing one? Interestingly, some recommendations for handling clogs have changed recently based on newer research. So if you've heard advice about vigorous massage or applying lots of heat, we now know there are better ways to manage a clogged duct more gently and effectively. Let's go over what actually works and why. First, let's start with some self-care. Staying well hydrated and getting as much rest as possible with the baby, let's manage expectations here, are essential when you're dealing with a clog. Taking care of yourself helps your body's natural processes work more effectively, which can help resolve the clog faster. Now let's talk about why I have this here. You may have heard of breast gymnastics. This technique involves gently moving the breast in different directions to encourage milk flow. It's a gentle, movement-based approach rather than applying direct pressure. This technique is actually incredible and what helped me with clogged ducts, and it can help move the milk around the clog without risking further infection. To do it, get comfortable. Find a quiet, comfortable spot where you can sit down or lie down. Gently lift your breast with your hand and move it in a circular motion. Try to rotate it clockwise, this way, and then switch. This helps to shift the milk and potentially dislodge the clog. Massage and shake. After rotating, gently massage the breast in the direction of the clog, moving from the outer breast towards the nipple. Lightly shake your breast while doing this to encourage milk. The point of this is to get milk moving behind that clogged duct. And breast gymnastics just is a simple rotation, up and down, whatever you feel is right to get that milk moving. Try feeding or pumping in different positions, especially with your baby's chin pointing towards the clog. You can also lean forward slightly while nursing or pumping to let gravity help. Do this routine a few times a day until the clog clears, but be gentle to avoid bruising the breast tissue. So when it comes to breast gymnastics, you want to do what feels comfortable, but also can mobilize that clog. Another method is dangle pumping. To do this, find a comfortable spot where you can lean forward, such as sitting on the edge of a chair or leaning over a table or on all fours. Lean forward so that your breast is dangling down. Gravity will help pull milk towards the nipple, which may help dislodge the clog. Begin pumping in this position. The suction combined with gravity can help clear the duct more effectively than regular pumping. If this is more stressful to you, don't do it, because key is also to reduce stress if we can. There are also some medications and supplements that can help. Taking an anti-inflammatory like ibuprofen can help reduce pain and inflammation around the clog. Icing your breast can also help to reduce inflammation. Remember, if something's inflamed, you put ice on it, which is a change from previous recommendations which advised heat. Old recommendations used to be heat and taking a breast massager or electric toothbrush and just digging into the knot. But we now know this actually can lead to more inflammation. So we want to use ice and gentle massage or breast gymnastics. Some people find that sunflower lecithin, a natural supplement, can help thin the milk slightly, which can reduce the chance of clogs in the future or if you're actually experiencing one at the moment. For clogged ducts, you can take 1,200 milligrams of sunflower lecithin up to 4 times a day for a total of 4,800 milligrams per day until the clog clears. Once the clog is gone, you can reduce the dose to 1,200 milligrams once daily as a preventative measure if you're prone to clogs. Of note, like any medication, including over-the-counter medications, this can have side effects. Common side effects include digestive issues such as stomach upset, diarrhea, or nausea. In rare cases, it may also cause allergic reactions, especially in people sensitive to sunflower seeds. Taking high doses can increase the likelihood of gastrointestinal discomfort. It's important to start with the recommended dose and consult a healthcare provider if you experience any unusual symptoms, especially if you have a history of allergies or are taking other medications. My go-to punch was ibuprofen every 6 hours for pain and inflammation while I was awake, and breast gymnastics. Move it around until the clogged duct cleared. And my, oh my, how much relief it is when it actually clears. Research also suggests that certain probiotics may support breast health and help reduce the risk of infections if a clogged duct does occur. Probiotics are the good bacteria that help balance your gut health, but they can also play a role in your breast health. When you have an imbalance of harmful bacteria in the breast, it can contribute to clogged ducts and even mastitis. Probiotics help by boosting the good bacteria, supporting your immune system, and reducing inflammation. By restoring balance to your body, probiotics can help prevent and manage these issues. So whether you're looking to prevent clogged ducts or get back on track, adding probiotics to your routine could be a game changer. This may be useful if you're prone to clogged ducts or mastitis, and above-mentioned tips don't help. When it comes to breastfeeding, continuing to nurse or pump on your regular schedule is key. Avoid the temptation to nurse more or less often than usual, as either can change and disrupt the milk flow. And importantly, don't worry about the milk safety. Milk from a clogged duct is perfectly fine for your baby to have. Also, from a psychological standpoint, don't be alarmed if you're seeing less milk production. This can happen when you have a clogged duct. But once you remove that clogged duct, you're going to see your milk supply go back to what it was before that duct occurred. With these approaches, you can often relieve a clogged duct comfortably and effectively. As always, if you're unsure or the clog isn't resolving, it's a good idea to reach out to a healthcare provider for support. When clogged ducts happen, it can be stressful. Not only is it painful, but the fear it will turn into mastitis can be stressful. Remember that not all clogged ducts will turn into mastitis. Stay calm, focus on the steps mentioned above, and tell yourself this is going to get better. Now let's discuss mastitis, which is a more serious condition that can occur when a clogged duct becomes inflamed and potentially infected. If you're dealing with mastitis, you're likely going to experience some specific symptoms. These can include fever and chills, making you feel like you have the flu. You might notice swelling and tenderness in your breast, along with redness in the affected area. It can be quite painful, and you may feel an overall sense of being unwell. It often develops from an untreated clogged duct, where the milk backs up in the duct and subsequently leads to inflammation. But it can also result from a bacterial infection, which can happen if bacteria enter through cracked or sore nipples. However, it's important to note that not all clogged ducts will turn into mastitis, but it's crucial to manage clogged ducts promptly to prevent complications. If you do find yourself with mastitis, treatment usually involves antibiotics to clear up the infection. However, some other steps you may try include icing the area, tips for removing a clogged duct that I mentioned already. Cabbage leaves are a soothing remedy for inflamed, infected breasts. They contain sulfur compounds that help reduce inflammation and swelling. Cold cabbage leaves placed on the breast can help reduce the swelling and discomfort. Continue breastfeeding or pumping to help clear the milk from the affected area. Rest is vital as your body needs to recover, so make sure to prioritize self-care during this time, using any help you may have to take care of the baby. It's important to know when to seek help if you're experiencing mastitis. Here are some key symptoms to watch for. Symptoms that don't improve in 24 hours. If you notice that your symptoms aren't getting any better after a day of managing them, it's time to reach out for help. Fever. A persistent fever is a red flag and should be addressed, especially if it's over 101 degrees Fahrenheit or 38.3 Celsius. Severe symptoms. If you're experiencing intense pain, swelling, and other severe symptoms, don't hesitate to seek medical attention. Difficulty breastfeeding. If you find it increasingly difficult to breastfeed or pump, this can be a sign that your condition is worsening. Repeated episodes. If you've had multiple episodes of clogged ducts or mastitis, this could indicate an underlying issue that needs to be addressed, or maybe we need to add probiotics, sunflower lecithin, or something else. If left untreated, mastitis can lead to some complications, including abscesses, which is a pocket of pus that can form in the breast tissue, which may require drainage, chronic mastitis, which is ongoing inflammation that can lead to persistent issues, making breastfeeding difficult and also really ruin the breastfeeding journey. Reduced milk supply. If mastitis becomes severe or recurrent, it could impact your milk supply in the long run. And in very rare cases, there can be systemic infection where the infection spreads to the whole body. And also the more common reason, dealing with mastitis can take a toll on your mental health, adding emotional stress to the physical challenges of breastfeeding. While natural remedies like compresses, frequent breastfeeding, and massage can definitely help alleviate the discomfort of mastitis, sometimes antibiotics are necessary to fully treat the infection. It's important to listen to your body. If you're experiencing fever, intense pain, or if the symptoms aren't improving, don't hesitate to reach out to your OB, midwife, or lactation consultant earlier than later. Always prioritize your health and trust your instincts. Have you dealt with a clogged duct or mastitis before? What helped you the most? And remember, ladies, keep those boobies in motion, whether it's breastfeeding, pumping, or breast gymnastics, to get the milk flowing. Don't forget to stretch, massage, and move to keep things flowing smoothly. If you found this video helpful, please give it a thumbs up sign, share it, and subscribe for more content tailored to help you understand your child's health, development, and behavior with confidence. Have any suggestions for future topics on this channel? Make sure you comment below and also ask me any questions or leave any personal experiences with clogged ducts or mastitis and what helped you. I hope I brought more confidence into your parenting journey. Stay informed, stay empowered, and I'll see you all next time. Stay well.